Earlier today, ICU doctors all around Ontario were calling on the Ford government to implement tougher restrictions as critical bed space dwindles, increasingly occupied by younger people. Jason Gaidola joins us now with more. Jason?
Following the Premier's announcement of the province's pending shutdown, one ICU physician in Hamilton believes the tightened framework isn't good enough. He was one of 150 physicians across Ontario who signed a letter sent to the Ford government asking them to implement appropriate measures. Physicians across Ontario are saying variant cases are overloading intensive care units, and with another lockdown coming this weekend, some believe more could be done.
You know, I'm so happy that we're doing something. Something is better than nothing, but I wish it had gone further.
Dr. Bram Roshwerg leads critical care at Hamilton's Juravinski Hospital and says a stay-at-home order is what is needed in order to stop surging variants. Roshwerg is one of 150 ICU doctors in Ontario that signed a letter sent to the Premier, Health Minister, and the province's top doctor saying, "We're seeing younger patients on ventilators. Many are parents of school-aged children. We are seeing entire families end up in our ICUs." The letter also continues to say about 4 in 10 patients who come to the ICU with COVID-19 will die.
But it is awful, you know, seeing people in the ICU, they're critically ill. They're on life support from COVID. And as I said, almost half of our ICU patients at the moment are there only because of COVID. It's what got them there. And the majority of them were previously healthy before.
Roshwerg added that Juravinski's ICU is near capacity, which is causing delays in other critical care. He says majority of the patients are in their 50s and 60s, but the age ratio is changing.
Although I'd say in the first and second wave, it was much more rare to have those 20 or 30-year-olds. We are seeing a higher proportion of maybe 30, 40-year-olds that are in the ICU.
He says nearly all of them are positive with a variant infection. Earlier this week, Ontario's Science Advisory Table reported roughly 67% of cases are from variant spread.
My personal opinion, driving around, you know, a lot of people are gathering in larger groups. And
during Premier Doug Ford's announcement regarding Saturday's shutdown, this is what he had to say about cases.
Now we're seeing a spike in the younger age group, and I just ask the young people, please, you aren't invincible. Now close to, 46% of ICU patients are in the younger age groups.
The Ford government's reaction today drew plenty of other criticism.
We didn't have to end up here. Back in February, the Premier got advice that indicated that we needed to take decisive action, and he just ignored the advice.
ICU physician Dr. Michael Warner also took to Twitter, denouncing that gathering was the issue, saying, "My intubated 30 to 50-year-old COVID patients were not congregating by choice. They were working in essential jobs where they have the highest exposure and the least protection." The group of physicians added that more hospital space will not stop people from getting sick, and not enough arms are getting vaccines. The letter also highlights how the variants have had a disproportionate impact on low-income and racialized residents, many of them who are also essential workers as well. Adam.